Liposuction is a very, very effective way to remove fat from the body, from places where fat is unwanted. It is not a technique for weight loss. If you need to lose weight, you should lose weight. But if you have pockets of fat in the body that, despite being close to your ideal weight, still exist, it's a great technique. And we essentially make tiny little incisions in the body. We add what's called a tumescent solution, which helps numb the area and also reduces the blood loss by injecting epinephrine. We do it under some kind of sedation, so you're not awake and you're totally comfortable. And then we remove fat from those areas. We do it with an eye for a smooth contour and an aesthetic roundness where you want it and a flatness where you want it. We go over before the procedure with the patient the photographs and where they really want the fat removed, and then we literally mark those areas with the patient so we can both see. Typically, liposuction takes 1 to 2 hours, and then following liposuction, we have the patient wear a compression garment on whatever area where the fat was removed so that it will reduce the swelling. It takes about a week to recover, but much longer to kind of get fully back to normal and to have no bruising and no swelling. So more like 3 months till you're back to, well, you're back to your new self, because you'll be much smaller than you were before the surgery. If you gain weight after liposuction, where's the fat going to go, and is it going to go to weird places? This is a really common question, and people call in on our radio show and ask us this all the time. And the answer is yes and no. If you gain a few pounds after liposuction, you're not going to notice any weird relocation of fat. If, on the other hand, you gain a lot of weight, because the fat's not going to go where you took the fat from. So if we took fat from your belly, you gain weight, the fat's not going to go to your belly. So it's going to go to other spots in your body, some of which may be places you'd be psyched to have the extra fat, like your buttocks or your breasts, perhaps, if you're a woman. But then it may also go to places where you don't necessarily want the fat. So I think that the take-home message is, you really, if you're going to have liposuction or any plastic surgery procedure on your body, you want to be committed to maintaining your weight within 5 to 10 pounds. Liposuction has gotten a lot of press for being dangerous, and I think that any plastic surgery procedure has to be approached with caution. You need to go to a board-certified plastic surgeon. You need to have liposuction done in an accredited facility, and you need to not do what's called massive liposuction. So if you need to lose weight, liposuction is not the answer. If you have small areas of excess fat that you want removed, I think liposuction is a great alternative. So you want to go to someone who's board certified in an accredited facility and have also a board certified anesthesiologist. And then I think it's a very safe and effective procedure. Can you do liposuction in conjunction with other body contouring procedures? Yes, definitely. And often it is in conjunction with other body contouring procedures. The best candidates for liposuction are candidates who have good skin that's going to tighten with the removal of the fat. And if you don't have good skin that is loose already and you remove more fat, it's just going to be looser, and then you need a skin tightening procedure. So you really need to be assessed very carefully by your plastic surgeon to determine if you also need a skin tightening procedure or if your goals can be accomplished with just liposuction. But in general, we sometimes combine liposuction with other body contouring procedures.